On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way.
Welcome to Health Her Way. I'm Meredith Cunningham.
And I'm Brooklyn Elbert, and today we're joined by Aubrey Rodriguez. Aubrey's a family nurse practitioner at Covenant Health, where she has been practicing for 3 years now. So welcome. We're excited to have you today.
This is I feel like the most unspecific topic that we've had on this show so far, but I feel like especially heading into the season that we are, it's so important to kind of know, when do we actually need to go see a doctor, a nurse, a healthcare provider? I feel like sometimes you think oh, it's just a cough. I'll feel better in a couple of days. I don't really need an appointment for that, but maybe you actually do. So that's what we want to break down today of when are we actually ill? When do we need to come in and see you? And when maybe do we just need to stay at home with our chicken soup and our, Netflix?
So and out of the cold weather with your wet hair.
Yeah, okay. That is literally one of our questions. Yeah, okay, we'll get to that in a minute when we talk about those old wives' tales. But let's start with the basics. This time of year, heading into respiratory season, what are the most common type of illnesses that you see?
Right now, we're seeing a lot of strep and COVID. We haven't seen much flu yet, but that's always variable. So sometimes we'll see it early, mid, early September. Sometimes it doesn't come till October. Sometimes it doesn't come to November, and we're not seeing it yet. So, we're always prepared. We're seeing some rhinovirus is going through, some terrible stomach bugs going around also, but no flu yet.
Did you say a rhinovirus? What is that?
It's one of the common colds.
Okay.
There's so many common colds, and rhino is one of them, although rhino can be very, kind of like RSV, be very troublesome some seasons. It just kind of depends on the virus and the strain.
Okay.
So some of the things you mentioned, cold, flu, stomach bugs, some of those, there's not necessarily antibiotics or medication y'all are going to give us. A lot of it, I feel like, is rest, hydration. But something like strep, that is something that needs an antibiotic.
Yeah.
So how do we know when? Is that why we go to you in the first place, is to get it tested to figure out what it is exactly that we're sick from?
I would say so. So fever for sure. I would get seen for a fever, shortness of breath, wheezing, especially those that are asthmatic, sore throat, painful swallowing. That could, it could be COVID, sure. But COVID has a treatment too. There's Paxlovid. So, they always say go to be sure you don't have strep. Okay, that's an antibiotic. But there's also Tamiflu for flu and also Paxlovid for COVID. So, even if it is one of those viruses, you still get treatment. But strep can turn into some nasty, nasty things. So you want to be sure you don't have strep. So even painful swallowing, I would go and make sure you don't have it.
So all of those symptoms you just mentioned, you can start with your PCP. That's a good place to go first.
Yeah.
Okay.
If you're having shortness of breath, enough to where you can't take a few steps, obviously you should probably go to the emergency room. But if it's just you're asthmatic and you're having to puff on your albuterol inhaler a little bit more, probably can go in and see your PCP or urgent care. HealthPlus has both. So.
Okay. We always hear this advice, though, if you're sick, stay home, because we don't want to spread any of those germs. If we do need to come to see you, what do we need to do? Do we need to stay in the car? Do we need to wear a mask? How can we help not get anyone else sick who maybe they're just for maybe a wellness checkup or something?
Yeah, that's a really good question, because HealthPlus has both urgent care and primary care. And so one of the biggest complaints I get from my patients is they have to wait out with a walk-in crowd. And so, I'll say, well, they should be wearing a mask. Are they wearing a mask if they're coughing? And usually it's not. People don't want to wear masks. But when they come in, we do ask if you have a fever, sore throat, runny nose, a cough. Of course, a cough. Please put a mask on. Be courteous to others.
There was a lady at Pilates next to me this morning who was coughing a lot, and I kind of side-eyed her, and she's like, I'm getting over being sick. I'm like, I hope that meant you're way over it. I don't know, but I was like, oh gosh, I just wanted to work out.
Yes.
Speaking of getting over a sickness, what is the common period of contagion for most of these illnesses?
72 hours.
Okay.
72. Unless it's strep, you're contagious until you've been on antibiotics for 24 hours.
Okay.
Yeah. So 72 hours. They used to do the 10-day for COVID. Then they went down, I think there was a 7-day in there somewhere. And then they went down to 5. And 5 stuck for a year, 5 days. And sometimes I still go by that. The last time we had a surge for COVID, fever was lasting almost 5 days. So I did up to 5 days, but now it's about 72 hours.
Okay.
So CDC recommendations.
When I got COVID at the very beginning, it was still during the 14-day
Oh,
period. So I
forgot
was
about the
locked in my
14.
room for 14 days.
Yes.
I think my mind wasn't that bad.
Yeah.
So for those of us who maybe handle these much better, I do have asthma, but I do say every time I get sick, I handle it pretty well. But how do you know, even if you have been to your PCP, it's COVID or whatever, but if you're sitting at home recovering, how do you know when it's bad enough that maybe you do need to go to like an ER or something? Like, what are those symptoms that make you go, oh, you actually should have been over this by now? Like maybe something else is going on or it's progressed. Because sometimes flu or something can lead to like pneumonia and stuff.
Right.
So
Any virus can.
Okay.
Even rhinovirus, or RSV. It's why these kiddos get so sick sometimes with RSV. Productive cough. If you're coughing a lot of stuff up, your fever is still going. Definitely difficulty breathing. I mean, of course, you need to be seen. But really that productive cough and fever. Get a quick x-ray. And walk in as long as you're not in a lot of distress. Our walk-in has chest x-ray, there. So it's totally reasonable to go there.
I got the flu a couple years ago, and I don't even feel like my coughing was that bad, but I did something to my ribs or something where I like bruised them, and I could not move. It felt like I couldn't even take a deep breath for weeks afterwards, and I had never had that before. But I went back and I was like, look, I had the flu like 2 weeks ago, but I can't breathe. And they did a chest x-ray, and that's what it was. I don't know what you call it. Like it was like something.
It'd be like pleurisy or
That's it.
something. Yeah.
That stunk, people. So if there's a
sharp, it hurts. Yeah.
advocation for getting your flu shot, that is it. And I got my flu shot that year. I don't think it was super helpful that year. But so that being said,
it's not. Yeah.
It's not.
This is not. Yeah.
So, but we do have vaccines for flu and COVID. They're supposed to help them at least not be so bad if you get them.
Right.
What do you, as a healthcare provider, do you recommend those things?
Well, I want to this is a sensitive topic, so I'm going to preface this with I'm very into whatever my patient wants to do. I try to give them, the education they need. What I know is facts, research driven, but I'm a very big pro-choice for my patients. So yes, I think you should vaccinate. Yes, get your flu vaccine. Yes, get your COVID vaccine, especially if you're asthmatic, COPD, elderly, all any kind of respiratory disorder, maybe even bad cardiac too. You want to get your vaccines, but that kind of protects the whole community too. The whole herd community. If you can get a lot of people vaccinated, it's probably not going to be so bad as a community if you do that. So definitely vaccinate.
My husband's a pharmacist. He'll agree with you. That's fine. Yeah. Okay. So I want you to be completely honest with us right now, especially in a couple of weeks when we are in the thick of this season and people are sick. I feel like sometimes people stay at home or we don't want to go because we don't want to feel like we're wasting y'all's time. Do you feel that way about people who come in, or do you think like I'd rather check everybody and know they're okay?
Yeah. Yeah. I'm one of those people. I don't ever. Okay. Well, let me back up a little bit. If someone comes in and they say, yeah, I woke up with a runny nose and a bit of a cough, I just want to get rid of it. I just want to get ahead of it and get rid of it now. Well, what is actually wrong? It's just a cough. You could have, it could be, early flu. It could be early COVID. It could be maybe just you were, mowed the grass yesterday. So I do ask that you wait at least 24 hours for your symptoms to progress. That way we have a little bit more information. Now, am I mad that I see them? No, absolutely not. I will talk anyone through whatever I need to. But it's more helpful if you wait for those symptoms to sit in a little bit so that one, our tests are accurate, and two, we kind of have a better idea of what you're going to do.
I mean, it's a good point, especially for those of us, it's cotton ginning season or whatever. So I think we all are a little.
Yes, that's
We
in
do
my
live
notes.
in West Texas.
Yeah.
With all the dirt and dust.
And they just started the, I don't want to say strip, I don't know a lot about cotton, but they planted it during the spring and now it's all coming up and they're going to start harvesting it. I don't know if that's the right term.
You know what? They're about as right of the terms that Brooklyn and I are going to be using. So it's okay. I don't think any of us are agricultural experts on this scale right now. So,
Okay, so what are the main differences and how can you kind of notice different symptoms in yourself between the cold, the flu, COVID, or just common allergies?
It's a good question, and it's one that's kind of dependent on the season. Kind of like flu vaccines are not made until they predict what strains could be out there. Well, each strain might bring you different symptoms. So, COVID this last time around had a little bit of GI thing, like nausea, diarrhea. It had fevers that lasted, a good 5-6 days, the cough, the congestion. The sore throat wasn't as bad as of a complaint last time, but this next surge that we are in, probably around the same time as flu, could be very different. But typically flu will be higher fevers, a very quick onset. I mean, you could be good, you wake up, and then by 3 o'clock, it just all of a sudden you're like, I kind of feel tired, oh, my throat, so it's very, very quick onset. I think that's the main difference between COVID and flu. And the common cold is kind of what I was saying earlier. It's just maybe you got a little bit of runny nose, sore throat, maybe you got a little cough. Maybe some low-grade fevers. Usually they're just kind of mild. And those are more the lesser COVIDs, like the rhinovirus. Something's going around the community that affects the eyes. Adenovirus can affect the eyes as well. Parainfluenza. But there's so many common colds, and those will be usually mild.
So what are
Allergies, no fever.
No fever for the allergies. Okay.
Fever.
What are things that people are doing when they're sick that either make their illnesses worse or prolong it? Like, I know y'all obviously recommend fluids and rest for a reason. So how are people not taking care of themselves when they're sick?
I think one, you could come in too soon, and that's really detrimental because a lot of those patients want maybe a steroid shot, maybe want antibiotics to get ahead of it. And I think that can make it worse. So actually getting seen early can be detrimental for you. Taking antibiotics from a previous UTI, maybe, or, maybe they were sick, like the URI symptoms then too. And so taking old antibiotics or antibiotics that you had in your cabinet are probably not a good idea and probably aren't needed. Yeah. Not enough fluids, too much sleep. Sleeping too much can be bad. So you don't want to just sleep your day away because you're not hydrating. You're not eating well. You're not getting up. You're not deep breathing. So you just want to be sure that you do those, you rest, but not too much. Oh, and maybe they don't get seen for their fever. I think it's really important to be seen when you have a fever.
Those are good tips.
Yeah.
And I think, as my husband would say, you're not supposed to have any leftover antibiotics. You're supposed to eat them all.
Yep.
No, and I love how in patients do go, I know what you're going to say, but I did take some antibiotics. So I'm like, oh, yeah.
Let me know how that goes.
Yeah.
At least they're confessing their sins,
They are. And that's usually what they do. Yeah. I shouldn't have done it.
Okay, so let's talk about that, about honesty sometimes. I feel like maybe sometimes we don't want to say something because we don't want to get in trouble. We don't want to be shamed, or we don't, but is it better for you to have all the right information to help them rather than be like, oh, well, you told me that like your head hurt, but you didn't tell me you had stomach issues or whatever, or,
Yeah, that can help piece it together a little bit more. You tell me anything and everything, it'll stay right there.
Yeah.
So, yes, please tell us everything.
So some of us have beautiful, beautiful children who like to sit on our face and cough or whatever and share all the germs. And we're trying to learn how to use tissues, but a lot of times I get handed a little boogie sometimes. I'm like, oh, thank you for that special present. So for those of us who have littles or maybe are caretakers who work with a lot of people with the public and things like that, what are some things that we can do to help protect ourselves this, season? And what, I mean, is it taking more vitamins, or is it what is going to help us?
I always joke, I always joke with my patients who are like daycare workers or moms to young kids, because I tell them, sorry, there's not, it is what it is. That's just what's going to happen. That first year in kindergarten or that first year in daycare is just going to be rough for the whole house. It really is. Trying to teach a 1, 2, 3-year-old, 13-year-olds to do the right thing, cover their mouth, is sometimes impossible. And who do they want when they don't feel good? They want their mom. So, I think you just have to kind of accept it for what it is. I don't think there's a lot you could do. Wear your mask, right?
Right.
And when COVID was at the height, I'd have these moms come in and they'd be positive, like, but I'm breastfeeding, and their whole life was over. And I'm like, just, if you're that, they were kind of okay with the mask at that time, but nowadays it seems so crazy to say you can put a mask when you breastfeed or something like that. But honestly, you can. But not when you're like cuddling and they want you and they want to be in your face. You can't do that. So honestly, there's probably not a lot.
Yeah.
Sorry.
Are there any like vitamins that you do recommend or at-home remedies that can help a little bit?
A lot said about vitamin C. I think if you just have a good amount of vitamin C in your body all the time, it's helpful. Just keeps that immunity going or boosted.
Yeah.
But if you're going to increase your vitamin C while you're sick, you're too late. That's my take on it.
A lot of people nowadays will, might be mostly when people are hungover, but when they're sick, have like the at-home
I do like the
IV people
stuff.
coming to
Yes.
get an IV drip.
I do like those things. I think I'm a huge sleeper. I'm really big on people needing to sleep and hydration. So, I mean, yeah. I'm all for the hydration.
I got a shot one time. I don't know what was in it or whatever.
Probably B12 and Kenalog, I'm assuming.
Something like that. And I wouldn't say it like fixed my symptoms per se, but I will say I just felt like I had more energy and stuff. Like I felt better and not so just blah like you are. So again, I don't necessarily think it fixed my problem, but it helped me not feel so bad from my problem.
Yeah, B12 gives you a great boost of energy and it kind of helps while the Kenalog starts working. I think that's the idea behind that. One starts working immediately and the other one kind of takes a little bit of time. But yeah, I think the shots are great.
Okay.
As long as you're not diabetic.
No problems. That's a good thing to say though, because, and I think a good point is why you should probably talk to a provider, specifically your provider, is because what might work for me may not work for her, or you see something on social media that you're like, oh, that worked for them, I'll just do one of that, and then it's not what we actually needed at all.
Yeah.
Okay. So call your own doctor, call your own provider, talk to somebody.
Or at least be seen by someone in their office.
Yeah.
You know, we all kind of help each other out. We all cover the walk-ins. So I don't know if that's how all offices work, but ours works really well to where if I see a Dr. Hendershot patient, I'm probably going to know quite a bit about him and I can make a good decision for his patient. So at least see someone in the same office.
Okay, so Brooklyn kind of asked a question earlier about like how long are we contagious for, but for kids who need to go back to school, for parents or whoever need to go back to work, when is it safe to go back and not share those germs, or to again give yourself enough time to rest and then go back and be actually productive and helpful?
Yeah, those are two different things. I always tell my patients, or say someone has COVID and I say, do you need to work? No, they're an adult. Do you need to work now? And they'll say, no, I just work at home. Say, okay, but like you don't feel well. You need to be resting. You need to be hydrating. You need to be taking, your Paxlovid, all these things. Can you do that while you work? Do you need some extra time? So I always ask them, like, even if they can stay away from people in quarantine, I still ask them, it's not just about that. It's about making sure that you feel better too. So as far as contagious goes, we do that whole 72 hours to 5 days. Kiddos, I think the schools are on to something. They send them home. You can't go back until you've had, fever free for 24 hours without meds. Of course, no vomiting or diarrhea. They don't want that either for 24 hours. But like strep, you take antibiotics for 24 hours, they can go right back. Will they feel 100%? No, probably not. But we want to get them back into school with the 24 hours.
So some people feel like, I don't know, sicknesses can't really get them and they just want to push through and kind of mental block their sickness. So what would you say to someone who just feels like they can push through an illness?
I think that if someone has asthma, heart issues, diabetes, elderly, very young, pregnant, who am I missing? Immunocompromised patients, maybe someone who is on immunosuppressants or chemotherapy or HIV, those patients should never push through. But for someone who's a healthy individual, maybe has only mild asthma, who is active, who maybe even good at BMI, don't ever, not taking medications on a normal basis, I think it's fair to do the over-the-counter medications, fight through your illness, get good sleep, do the right thing. But if you have any of those comorbidities, I think you should be seen.
Is that also a benefit of going to see a doctor or provider when you're sick? Is that I think sometimes we can try to self-diagnose, but then you go to the aisle and even though you can technically just pick things up, how do you know what you actually need or what combinations are good?
Mm-hmm.
Do you accidentally pick up two of the same thing and you don't realize it or whatever? And so is that why it's good to come to you guys and you can help guide and give a good list of like, you have a cough, so we need this, but you also have congestion, so you need like this.
Yeah. I do try to guide my patients with OTC stuff, especially ones that are willing to not do the antibiotics. So if they're willing to like, no, I want to do this over the counter, give me some good options, and yeah, I'll go through with them. But you know what I love to tell patients is, you need to talk to the pharmacist, because my husband's in pharmacy school, but I've learned a lot about the pharmacies and the pharmacists, like what they can actually do, what the knowledge is, and they're taught heavily on OTC. They're supposed to be able to guide, to consult those patients. So I will often tell them, hey, like, your pharmacist should be willing to talk to you about that. They should show you, they should know like they should ask if you have high blood pressure. They would, say go more towards the high blood pressure medications. Like HPV or cortisone are good for over-the-counter medications for sinus issues, but safe for those with high blood pressure. But a pharmacist can guide your thought process and give just as good advice as we can.
Is there anything we were missing that we have talked about today that you think is just super important for our patients and audience to know about what you do or coming to the doctor when they're feeling poorly? And maybe not even just seasonal illnesses. If they have injuries, should they come to you? If they have other issues.
That's part of the fever thing. We catch a lot of UTIs because of the fever. In young women, in elderly women, men, elderly men. So that's another reason why I always say the fever, because you never know what is actually going on. But yeah, we see anything in our clinic. Obviously if chest pain, severe abdominal pain, uncontrolled vomiting, diarrhea, you want to go to the ER. But if it's just something mild or even urgent, then we're equipped for it. And we didn't talk much about some of the, this is Health Her Way. So what advice do you have for women who are caring for sick children, partners, or aging parents? That's hard, and they're all a little bit different, but I think it's a good question. Obviously, for sick children, you got to be patient, and they want to cuddle. We already talked about that. They want to be kind of in your face, but encouragement, distraction, hydration, rest. If your partner is sick, all you can do is have patience with that man. Really nothing else you can do.
I always see
the man flu.
Yes.
Videos where it hits them 10 times harder.
Yeah, it's so real. So just have patience with them. They can take care of themselves. I'm just kidding. And then for aging parents, just use your resources. Talk to your primary care and say, there's so many resources for the elderly through insurance, through home health. So just know that you're not alone, because that's very hard to do. There's equipment that can help keep their independence for longer, shower chairs, transfer chairs, things like that. So I just wanted to touch on that.
No, that's great advice. Absolutely. So we normally at the end of our episodes have a trending topic that we want you to talk about, but instead we want you to play like myth or fact with us. We have some old wives' tales that we want you to debunk for us. Okay, number 1, going outside with wet hair causes a cold.
Myth. It makes me even more frustrated when people say it's how they got strep.
Oh, because those two things are correlated.
Right. Yeah.
That's what their mamas were telling them growing up.
No.
Okay, chicken soup cures a cold.
I've actually never heard that one, but that's a myth.
Okay. Still tastes good when you're sick.
Right. Comfort.
Yeah.
TLC, tender loving care. And that's what it does for you.
Maybe the salty broth and the fact that you're just eating anything at all.
Yeah.
Maybe.
Yes, exactly. Yeah.
Okay, we'll go with that. Okay, vitamin C can cure a cold.
It kind of like we talked about earlier, if you're going to start it in the middle of a cold, you're not really going to do much. But if you consistently keep your vitamin C high, like everyday life, then yes, that will help your immunity. And so you'll be able to fight things a little better. But I love an emergency when I'm sick. I just like, maybe it's the B vitamins in it that gives me the energy, but I will totally emergency twice a day.
Okay. So facts, or is that the verdict?
Well, it's a myth, but
okay.
It makes me feel better.
Placebo effect, right?
Yes.
Okay. A flu shot can give you the flu.
No, that's a myth. Yeah, it will. If you might get a fever, even a high one, for 24 hours. You probably feel malaise, really tired, but that's a good thing. That means that your body is actually doing what it needs to do. And also, for 2 to 3 weeks after you get your flu shot, you can actually get flu because your body's trying to build the immunity. So when some people say it gave me the flu, sometimes it's like a week or 2 after, and that could actually be the flu. But you still build immunity, and the vaccine will still work.
It just hasn't kicked in yet.
Right.
Yeah.
Give your body some time.
Okay, so this one is a fun one. Putting onions in your sock to detox.
Never heard that myth.
Really?
No, it's got to be a myth. But let me know if you try
They
it.
didn't teach you in any of your medical programs?
No. But try it and let me know.
I don't think I'll be trying that, but
I think it's one of those things that if it's not that expensive and you're not really harming your body, if it makes you feel better, is it that big of a deal?
Right, like the emergency,
yeah.
It's hydrating.
Yeah.
Getting some B vitamins.
I mean, I just don't even like when my socks are like folding weird on my feet.
Me
I
either.
don't want onions
Me
in there.
either.
How do you sleep with a whole onion at the bottom? I don't know. I've never tried it myself.
The only thing I really believe in as far as like food and like health goes is the cabbage on the breast for breastfeeding. You know what I'm talking about?
No?
Yeah.
Where were you when I had a kid 3 years ago and was trying to feed it? Good Lord.
Yep, cabbage on the breast.
Okay. Well, thank you so much for being here today. Thank you for helping educate us and not make us feel bad about coming to see our doctors and our providers and actually getting treated when we are sick. So
Yes,
thank you.
please come see us. I'm not trying to put HealthPlus out there. We have other urgent cares, but HealthPlus is a great place. So
Absolutely.
yeah, come and see us.
Well, to hear more about any of our experts, you can follow us on Health Her Way on Instagram, Facebook, YouTube, and listen anywhere where you can find your podcast. And we will see y'all next time.
This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician.